Good afternoon, everybody, and welcome to episode 199 of the On Air Advocate. Where at the On Air Advocate, we look to provide education, support, and empowerment for all of those with different abilities, mental and medical illnesses, and their caregivers. For those of you who may not know me, my name is Tammy Flynn, and I am the host and producer of the On Air Advocate. And I am super excited if you are here this afternoon joining us, or whether you are catching this on the replay. Now, as always, if you think any of the content that we could be talking about could be valuable for anyone in your network or your circle, please hit the share button and share the love with others. And I know today we are streaming on some different platforms, so however you can share our content from those platforms, please do so. Well, today we are kicking off our mental health awareness series for the month. And I am so excited to have back on the show to kick this off with me, AndyRiggs. He is a morning radio show host. He is also the American Foundation for Suicide Prevention, Wisconsin co-chair and Out of the Darkness Walk chairperson. Welcome back, Andy.
Welcome. Well, I'm not the chair for the walk this year. I'm all of those. I have a mouthful of a title there, don't I?
You do. I had to stop and pause to go through it. Now, are you guys, before I have you tell us a little bit about your background and whatnot, are you guys doing your walk virtual this year?
That's up in the air. We did our Madison walk, our campus walk last month, or excuse me, that was in March. Sorry, the days and months blend together, don't they?
Yeah, yes, they do.
We did do our last walk for Madison. That was a virtual walk, and it is still up in the air as far as our walk this October, what we will do for our Milwaukee walk. But there are a couple other ones that are happening around the state that are still pending, but we're waiting to see how the cards play out, because things are changing by the minute. I don't know if you saw it today in Wisconsin, Governor Tony Evers at noon said, okay, strip malls can open with restrictions. And we're like, what? So it seems like something can always happen.
I missed that. So I will have to.
Yeah, that just happened today in Wisconsin. So go ahead and look it up if you'd like to. But I mean, with restrictions, they're doing it safely. But there's a lot more things that will be open in Wisconsin. But so yeah, we don't know what the landscape is going to look like in October or September when our fall walks will start happening, but we're keeping an eye on it, and we definitely want to be there for the community, because our Out of the Darkness walks, if you're not familiar with them, they're not really competitive. That's not like you don't get a bib. It's not a 5K. It's not you get timed. It's more of a community event for us to all kind of come together and support one another and be there as a community for those that have lost loved ones to suicide. So.
Right. And if we can rewind for a hot minute, for those who maybe didn't catch you last year on the show, can you give the folks just a little bit of your background and how your focus, drive, purpose really became all about mental wellness and sharing that with our community?
Yeah, I've unfortunately lost my uncle, Rick, to suicide in July of 2017. And that was, I'd seen suicide before, and it had been, in movies, you see it on TV, and it's just kind of as a passing thing. And it's like anything in life, until it affects you personally, you don't really give it as, a second thought, right? I mean, anybody can say that, and it's unfortunate, but that's the way that we are as humans. We're a little bit selfish, but that's okay. So I lost my uncle to suicide in July of 2017. I sought out one of the Out of the Darkness walks and realized that there was a need for support of people who had lost people to suicide. And I realized in talking to other people that had lost loved ones to suicide that I wasn't alone in that grieving process, and other people could help me, and I could give my support in turn to others. So I started getting much more involved after that, and I grew into a board position with the American Foundation for Suicide Prevention. I helped facilitate a support group that runs every month, put on by MentalHealthAmerica of Wisconsin. I facilitate a support group for survivors of suicide loss. I've also gotten more involved with my podcast, Riggs Off the Radio. I tried gearing that more towards mental health as well. I could try to gear it towards men and mental health, because I think that men are the worst at dealing with their emotions and their feelings, because we're always taught as men to push down our emotions and to carry all of the weight of everything and just suck it up and get through it. And it's just not healthy for anybody, especially during these unique times that we're living in. Yes. Pushing down your emotions and holding things in right now is just going to start a very nasty, bad foundation for your mental health moving forward. So I realized there was a need for the conversation, and I had a voice on a platform of a radio station. So I decided just to start talking about it and start being a lot more open about mental illness and mental health and suicide prevention, and just making it normal to talk about these types of things, much like you would talk about diabetes or heart disease or anything else.
Right. And I thank you so much for doing that, because you
Yeah.
are really out there and really touching the community with all of the things that you're doing, and giving resources too, and guiding people in places that they can go. So, when I reached out to you about being on the show for this month again, one of the things that I really, really wanted to dive into, which we haven't done any, pure segments on yet, is really the whole unique state we're in right now, and how that is affecting everyone's what used to be normal, their new normal, the social isolation,
Yeah.
the social distancing, all of that. And so when we look at it from the mental health perspective, and you've been talking with the people within your organization, are there some key things that you would really urge people to, in this time of uncertainty, to kind of either remove themselves from for a better self-care, mental wellness aspect of things, as all these things are transitioning and there's change every single day, and keeping ourselves as grounded as possible?
Mentally well. Yeah.
Really well.
Yeah, there are some things that we can absolutely do, because like you said, there's a lot of uncertainty, and humans are social creatures by nature. We love hanging out. We love congregating, families, friends, gatherings. That's what we do. So when we're told that we can't do that and we have to isolate that, obviously now you're in a totally unnatural situation, right? So a lot of the things that cause our panic and our anxiety and even our depression are a lot of things that we can't control, that we allow to control us. So I always like to tell people to, first of all, worry about the things that you can control and focus on those things. And that can be as simple as making sure that you're waking up at a regular time, giving yourself a routine, a sense of a schedule, making sure that you are staying well, both mentally and physically, that you're doing some sort of exercise. You don't need to be doing 90-day fitness workouts and like ab workouts every day. I mean, if you want to, and that's your thing, that's fine. But there's a great amount of benefit mentally and physically to just getting up and getting some fresh air, walking around your yard, walking around your house, getting some sort of exercise and moving. Those are things that you can control. You can control your diet. You can control the types of food that you're eating, how often you're eating, when you're eating, what you're putting in your body. You can control your schedule of what you're watching on television. You can control your social media intake. So if you are getting overloaded with news and you feel like it's just caving in on you and there's so much gloom and doom and panic on the news, and that sells in the media, unfortunately. So you can control how much of the news that you take in, limit how much you're watching television, limit how much you're on social media, if that's a big source of your anxiety. So focusing on those things that you can really control is the greatest thing ever, because the things that are out of our control are out of our control, and worrying about them does nothing but cause undue worry and anxiety and stress on ourselves. So seeing people that go out that don't wear masks in public can be infuriating to you. Maybe that's a thing that you're passionate about, but you can't control what somebody else does or doesn't do. You just have to hope that they are getting the message from health and government officials, and they're taking things as seriously as they can. You just have to know that you yourself are doing what you're comfortable with. If you're comfortable wearing a mask, that you're wearing one. If you're comfortable wearing gloves, you're doing that. You're washing your hands. You're limiting yourselves out in, larger social situations. Maybe you're doing delivery and pickup for groceries. Worry about those things that you personally can control, because there are so many outside factors and so many uncertainties that you could worry all day if you wanted to, and just create all this panic in your head and make up these scenarios that will start to spiral out of control. And especially if you're already prone to anxiety or depression or even obsessive compulsive disorder. I mean, we got to be mindful of our mental health now and kind of own the curve of that mental health. Because I think if we aren't mindful about it now, and we aren't having these conversations and doing programs like yours and mine, we were not going to be aware of our mental health. And I fear that the next pandemic, if it's not already, will be a mental health pandemic. So that's how I feel.
Yes.
Worry about what you can control.
When we talk about that social media and you kind of being in the media itself, mainstream, like you do your own thing, but also being on a main radio morning talk show.
Yeah.
I have felt, I feel like for myself, I'm usually pretty level-headed in the sense like knowledge is power. Get your information from the best sources, you know what I'm saying? And then watch and see, wait, and you know what I'm saying? See how things unveil, kind of turn out. I'm not a jumper, a watcher and seeing. But this has really been something where I've had to, I removed my television from my room.
Yeah.
I am like, I have days where I don't go on my own social media because I'm like, okay, one more thing, because, as well, my other businesses that I own, one of those being a business that is shut down currently right now. And so I sit in on all these summits, where they're talking about what we're going to need and how we're going to need it and what people aren't doing and who's getting fined. And, it's just such a source of anxiety. And so, trying to get folks to, feel like they want to get that knowledge, and want to have good sources to get information. I find like right now, do you find that that's a hard thing for anybody to find? In this, is there somewhere that you direct where, you're like, I listen to this per day, take the value I think out of it and turn it off?
I like to, I started this, I don't know if it's a normal thing or not, but I started something called living in the emotional middle of things. Mm-hmm. And I feel like there's two extremes in really any situation in life. If it's black or white or red or blue, Democrat, Republican, thinking that the virus is a hoax and it's ridiculous and being overly panicked about it. I feel there's two extremes in really any situation. And I think we're all healthier being in the middle of a lot of these things, to not be panicked about what's happening in the world, but you just be vigilant. I think vigilant is a lot better. It's a better word to use, and it's a much better practice. Panic means anxiety and uncertainty, and you can't control panic. Panic is out of control. Vigilant is knowing what's happening, keeping yourself informed, and doing what's best for you and your family and those around you. But it's on the other side, it's not good to be flippant about it, to think that this is just a stupid thing and everybody's making it up. You want to be in the middle of the whole situation regarding what's going on right now. I feel that it's healthiest for us to be in that emotional middle of everything, where you kind of take a little bit of the panic, because it is a serious situation and it could get out of control if people aren't careful. Right. But also know that this doesn't last forever. This is not going to be forever. There are hundreds of brilliant scientists around the world that have been working on a vaccine for months. So right. It will come to an end. It's just knowing when the end is going to happen. We don't know yet, but I mean, things are gradually starting to open up. Life is starting to return to some sort of sense of normalcy. It's not going to be the way that it was in the past. I mean, this is something that they're going to write about in history books, that we're going to tell our kids about in the, down the future. So I think living in the middle and finding a way to live in the emotional middle of life is really one of the healthiest places you can be, because you've got kind of the best of both worlds and you formulate your own opinion for yourself, and then you move forward with life. Is that a question? Kind of?
Yes. In talking about that, developing what that normal, but really it's going to be our new normal. Yeah. That's going to be in that processing. When I chatted with other parents that are kind of in the caregiver role, special needs parents, whatnot, a lot of us can reflect back on when we had to develop our new normal. And so this kind of seems like a phase of that where, whether it was when our child was born or at mid-age, or those caring for their elderly loved ones, it's kind of like that mourning process, that anger, that transitioning to get to that new normal. And so through all of these different mental health, organizations, through the organization you're involved in, I know you were saying that they're doing some support groups and things like that. It took years, obviously, for us as parents to develop our new normal, to be okay with what life was going to be, what we thought it was going to be, now what it's going to be, and really embrace it and still love life to the fullest. And, in every single day and all of the aspects of it, what would you say to that? Like, I mean, are there groups right now that are meeting that can help people through this process? Because I see it out there, and if you watch, social media for a hot minute, it's like the emotion and then the anger and then, the people who are trying to be funny about things, and it's all these feelings. And so is there a place, within these different organizations that if people are just feeling like, I just can't get a grasp on this?
Yeah. I think our support group specifically is for survivors of suicide loss.
Mhm.
So I don't know if that would be a best fit for anybody outside of that. That's kind of a niche group that I am on, but I know Mental Health America hosts some other groups around for depression or anxiety. People can reach out for that. It's mhawisconsin.org is the website for that. But I like your parallel of having someone with special needs or being able to grieve that. Not grieving having a child with special needs. That's a wrong word to use for that, but accepting a new normal, I guess, is what you could say.
Right. But I would say that every parent would say they went through some type of mourning/grieving process. So I don't think you're wrong in that, to be like,
Right.
okay, well, this is what I thought it was going to be, and now this is what it is. And you're scared because,
Sure.
most, precious loved ones.
But
And
I think everybody is grieving right now. We're grieving our past way of life, the life that we had before. We're grieving not being able to go out in groups with our friends. We're grieving. I mean, we're kind of entitled as Americans to be able to drop, and do anything we want at any moment in life. You want to go to the grocery store, get up, go to the grocery store. Oh, I forgot bread. I'm going to go back, turn around and go get bread. Oh, I forgot mayonnaise. Damn it. I'll go back and get mayonnaise again. What my friend just called, they're going out for drinks. Great. Let's go out for drinks. You could do all that. Now, all of that has been stripped away from us. So I think everybody is going through a grief process. That's why you're seeing all of the different stages of grief on social media. You're seeing the anger, you're seeing the acceptance, you're seeing the joking around, you're seeing all the phases of grief. We're all going through that. And I think that it's okay for you to do that. Like, it's okay to be upset that you can't get a haircut. It's okay to be upset that you can't just take a trip and, go to California to visit your mom. It's okay to grieve about that. And because other people may have it worse than you, doesn't mean that you're not entitled to feel the way that you do. So don't hold back on being upset about something because, well, somebody else has it worse because they know somebody that has coronavirus and they died. And that's sad for that person as well. And that doesn't mean that you're not acknowledging their grief. You are, as an individual, are allowed to have the feelings that you do. You're entitled to your feelings, and we're all allowed to grieve at our own pace. So I think that's what's happening right now is everybody's grieving. Whether you want to accept it or not, we're just grieving our past way of life. What we were doing as Americans, we can't do. And now we have to realize what's it like moving forward. And that's very uncertain.
Yes. And in that new normal, respecting where everyone is also at, I think, because like you said, in my circle of friends and people I know, I have some that are to the extreme, but they've also lost loved ones, had 3 family members in the hospital. Your perception of this is completely different, when you have people that are affected by it, as if not. And so I think us all coming together as Americans and respecting where everyone is at, because we are all truly in this together. Our viewpoints a little bit different. I made a whole entire list for you. So I want to make sure I don't throw myself off of that.
No, I love the list.
So can you tell me a little bit, during this time, I saw that you're doing the mindful, is this just for the month of May that you're doing the mindful minutes?
Yep. For the month of May, it's the mindful minute. Because I think a minute it's a easily digestible amount of time. It says what it is in a minute, and it's being mindful. And I think we can all be more mindful of the way that we feel with our emotions. And today, my mindful minute was about going through kind of like a 4-step process and processing your emotions. So you're much more mindful of what's going on in your brain when you have anxiety or when you get scared or when you get angry or when you're feeling overly happy about something. Just going through your emotions in that aspect. So I posted that today. I've talked about talking to your children about mental health, just depression in general. I talked about the difference between anxiety and stress, how they're kind of related, but they're not. But I think a minute is enough time to kind of give some information, to kind of give a couple examples and to kind of open people's minds to something that they may not be thinking about already. and then allow them to go and do research on their own. I don't want to beat information and shove links down people's throats, but I do want to say things that people maybe don't think about. Like tomorrow I'm discussing eating disorders, which is an often overlooked mental illness that people don't talk about, I don't think, enough. And people, men, women, all different ages can suffer from an eating disorder. It can be overeating, undereating, and it's not talked about a lot. And some people may be suffering from that. I know a friend that has that and not even know it's a mental health thing. They might just think, oh, he just wants to be on a diet. That's why Sean hasn't been eating. He's just dieting. No, Sean may have body image issues, and Sean may be going through something. So starting that conversation. And that's another thing that I like to do with the Mindful Minutes is start a conversation, start a real conversation like we're doing right now. So whatever it may be about, I think a minute is a good enough time to kind of digest something. And I'm not asking for people to sit down for 40 minutes for me to give them a lecture and the slides. Well, there's a lot of benefit in that when you're getting ready to sit down and plan your brain for that. But if you're just flipping through and you see mindful minute, oh, this won't be more than a minute. It's not going to take much of your time and you might get something out of it. Who knows?
Yes. Well, I love it because all of them that I have watched, I think are just great. And so I will be sharing those on the show all month long.
Oh, thank you.
Some of those, and you guys can hop on. And that is on the American Foundation for Suicide Prevention, their Facebook, correct?
The Wisconsin chapter, yes.
The Wisconsin chapter. Okay. So we'll drop that next to there below. And, I guess at this time, with all the social distancing, the isolation, all the different things that we've been through, what would you say, aside from what you've already shared with us, is probably at this moment, mental health-wise, self-care-wise, the most helpful or resourceful things for us to do to kind of calm ourselves?
Stay in touch and stay connected. Keep connected with your friends and your family. We've got the tools now. We've got social media. We've got our phones. We can do video chats. We can do FaceTime chats. We can do StreamYard things. We can do Zoom group meetups. Continue to do those things. Continue to stay connected with people. And if you're comfortable and you're in a situation where you can go to a friend's house and be at a safe distance and see them face to face and sit in the front yard and put up a couple chairs, I don't think there's anything wrong with doing that. I don't know if I'm allowed to say that, but I really think that we need things like that to start going. I'm not saying to throw a big house party, but if you have a friend that you're close with, that you need to talk and it's going to benefit your mental health positively for you to go and have something to look forward to. Hey, this weekend, I'm going to go to Tammy's house and I'm going to put up a lawn chair in her front yard and she's going to sit on her porch and we're just going to talk and see each other face to face. You have no idea how good that's going to feel. It was a neighborhood happy hour with our neighbors last weekend. And we sat up our chairs in our driveway. They were right across the street and we talked and we caught up and their kids were there. They were playing across the street. And it was just nice to have that little bit of human interaction, knowing that you're still doing it safely outdoors. But if you're still not comfortable doing that, I think continue to stay connected with people. That's because isolating and being by yourself and holding all of your emotions and feelings inside is just going to be nasty for you down the road. I mean, it might feel like you're doing the right thing now. I don't want to burden people with my problems, but that's the absolute opposite. Don't be afraid to burden someone with your problems. Don't feel like you're going to burden them. And when you call someone and reach out and say, hey, I'm feeling really isolated. I'm feeling really down right now. Can you just listen? I just need you to listen. Yes. That's the best thing you can say to somebody. Because if you tell me that I need to listen to you, that's fine. I can listen. But I'm also not a mental health professional. So I might be taken back and be like, I don't want to say the right or the wrong thing. But if you just need someone to listen, tell them that. Say, I just need to get some things out right now. I don't need you to respond. I just want to talk. And sometimes that makes you feel better too, just getting your feelings out into the open so they're not stuck inside your brain anymore. So I think continuing to stay connected, if it's virtually first, and if you're comfortable in that situation to do a socially distant meetup, go for it at this point, I think.
Yesterday, to speak to that, my best friend, she came to my house. It's on my regular Facebook page, and she brought me Mother's Day flowers and whatnot. She's got her mask on in her car. I had a mask on. It was raining, so I opened my garage. She dropped the stuff there. We talked probably 8 feet distance. Yeah. But you get to see everybody. I've done that with my sister too, just in the driveway. She's on one side, I'm on the other. We have masks on. And, I think that is so important to stay connected. Definitely.
That's the best thing we can all do right now. And you're doing it safely too. You're not, if you're going to have a family reunion tomorrow, I'm going to be like, I might question your judgment. At least for now. But
Right.
Staying connected is so important right now. It really is, because we crave that connection as humans. We crave human interaction. So keeping that sense of normalcy is nice.
And is there any other organizations that you would recommend that are here either nationally or right here in the state of Wisconsin? Because some folks that are going to watch this, may not be from the state of Wisconsin, that might have some great resources to tap into, putting up information, which I have definitely been seeing a ton more coming out from different places, even on the end of kids.
Yeah.
Kids are dealing with this and being home from school and the emotions of all that and their change and all of that as well.
Yeah, well, there's the big ones, of course, the National Suicide Prevention Lifeline. There's 1-800-273-TALK. There's the crisis text line, which is you can text. There's a myriad of things you can text. You can text hello. You can text hope to the number 741-741. Those are for the crisis situations. If you feel like you're in a mentally desperate situation, or even if you have a friend who you're worried about, you could call that number or text that number, and those people are on call 24/7, and they'll gladly give you advice on what you can say to somebody that might be in a crisis situation. Of course, the American Foundation for Suicide Prevention, I'm on board for them. I think they offer a lot of great programs. We're offering a lot of those virtually, as far as Talk Saves Lives and More Than Sad, or kind of introductory mental health topics, topic type discussions, kind of talking about mental health, talking about suicide prevention. MentalHealthAmerica of Wisconsin is another great resource. MentalHealthAmerica is a national chain, but I specifically work with the one here in Wisconsin. And they've got a great layout of resources and information. Almost everybody right now, if you just Googled COVID-19 mental health coping, you're going to find so many different resources. The Mighty is another website that does, they have a lot of things that are mental health related, and they have people that contribute to that, just regular everyday people that'll write amazing blogs that you might, connect with. And then you can share that with your friends and start a conversation that way. So I'm glad that mental health is being discussed right now, because it's a really important topic outside of coronavirus. I think we need to be very mindful of our mental health and vigilant about our mental health, and making sure we're talking about our emotions, getting it all out there.
That is so correct. Well, I thank you, Andy, for taking time. I know you've had a long morning already, and for you to join us today for the kickoff of our mental health awareness series.
Yeah, they stretched our show till noon, Tammy. Noon. I'm here all day now. It's awesome. I really do love my job. I love what we do, and I love that our list. What made me happy this morning is when we said we were on till noon, is people were texting our show saying they were happy that we were on till noon. And I was like, okay, if people are genuinely happy, they can hear us more, then I'm excited about it too. So
yes, and that's all speaks to that whole connection. You know what I'm saying? Because in the morning, you're the people that everybody's listening to, and now they're, if you're working from home, whatnot, they just want to hear more. Before you know it, you're going to be there all day.
Oh God. They're going to pay me more for that, maybe? Don't talk to my boss.
All right. Well, but we'll send them. All your fans will be like, I think he deserves a little more.
Also, our company Entercom that I work for, which is a great company, we have an organization called I'm Listening. It's our mental health initiative. IamListening.org. The letter M, listening.org. That's our mental health initiative, and we have a lot of artists that talk about how they're coping with mental health, just to kind of relate to our listeners, because sometimes seeing your favorite artists like Halsey or Macklemore, whoever you listen to, talking about how they have mental health struggles as well, kind of humanizes them and can make you feel like, you know what, I might have some of these similar issues on my own. Maybe I can talk to somebody. So I really love the efforts that our company does with I'm Listening. So that's another resource.
Or just a website to that?
I'm sorry?
Does that have a Facebook page or a website?
I believe so, yeah. And you can link up to all that from the imlistening.org website. So. Okay.
All right. Well, I will connect to that as well.
Yeah.
And all the amazing resources that you gave. So, so happy that you are here again to here with us, and thankful for all of the frontline workers that are still working, and our state is still closed. I know some of the people I'm interviewing, their states have already opened, and that's a transition in itself. So I think at every phase of this, we are going to have, milestone steps to take into our, new normal and feelings. And
yeah. Another thing, if you know healthcare, if you know anybody in the healthcare field, reach out to them and just check on them every once in a while, because they're going through some stuff right now that I can't even imagine. My mom included. My mom's an X-ray tech in South Carolina, and she's inches away from COVID-19 multiple times a day. So reach out to your friends that are nurses or doctors, or even that work in a hospital in any capacity, and just check on them, or anybody that you know that is having to go to work during this. Reach out to them and just give them a check every once in a while. Hey, just wanted to say hello, see how you're doing. Doesn't need to be an intense conversation, but a lot of those people crave that sense of normalcy of just a friend reaching out saying hello, because it's the little tiny things. Just checking on someone can really go a long way.
Yes, so true, so true. And everyone remembering that they are not alone, that we are all in this together, and doing that reach out. So I love that. I do that with texting. I keep a file and I just go back over it every, week or so and do the reach out, because it means so much when people do it to me, doing that back as well. I mean, it's just so important for that connection. But thank you so, so much, Andy. I really appreciate it. I'm going to drop all the links below. If I miss any, maybe you can throw
a lot. Sorry.
And I'll be sharing those mindful minutes. And I thank you again for sharing with us today.
Of course. Thank you for having me on. I appreciate it. And thank you for making mental health a priority with your on-air advocate as well. I appreciate it, Tammy.
Thank you so much. And if anybody wants to know more about the On-Air Advocate, you can head on over to onairadvocate.com, and all of our resources are right there, or on our Facebook channel. We also have a private community that you can hit the blue button if you're on Facebook right now, and you can hop right into that community. So with that, thanks so much. Have a wonderful afternoon and a happy Monday to everybody. Bye-bye, everyone.